Good evening. My name is Nadine Taylor, and I'm a public health nurse consultant with the Minnesota Department of Health. Tonight we are going to be talking about TEFRA medical assistance, and this presentation is taken from the Minnesota Children and Youth with Special Health Needs Programs manual that we create called Who Pays Taking the Maze Out of Funding. So this is just one topic out of the whole manual. If you'd like to see the manual and download it, it's actually about 200 pages of a variety of services and resources for children and youth with special health needs. You can go to the website that is listed there on your first page of your PowerPoint and download that. Okay. Feel free again to type in any questions throughout the webinar, and at the conclusion we will try to address as many questions as we can. We're going to go to the first slide of the PowerPoint now, which is the overview of medical assistance. This is just to give you some background about medical assistance program. It's a potential financial resource for medical care. It can cover birth through death, age of adults and children, but tonight we are focusing on youth and children, infants up to 19 years old. The MA funding program is through the Minnesota Department of Human Services. Sometimes you'll see Department of Human Services abbreviated DHS. And medical assistance can pay for all or some of your children's medical bills. That could be medical bill, dental bill, hospital bill, mental health. It can go back and pay old bills. It can go back and pay 3 months. Your child can have private insurance and still be on medical assistance. That's something a lot of people don't know, that you can have insurance and still be on MA. That's very important because today so many people have such a high deductible that they have to pay before insurance will kick in. And today many people's insurance also has copays. And then the last bullet there, that when determining financial eligibility for medical assistance, if you're in a family with a step-parent income is not counted, and also assets that the family might have, like a $10,000 in the bank or a lake cabin or a snowmobile. Assets are not counted for determining eligibility for children. They are for adults, but not for children. On the next slide, you see some examples of MA-covered services. This is not a complete list. It's just some of the more common things. Dental care, doctor visits, glasses, hearing aids, home care, including PCA services, hospital care, IEP or special education services at school, which would include the OT, PT, school nurse, mental health care, like I said, lab, x-ray, prescriptions, and also transportation. That's transportation for medical care. So I know some of you are listening to the webinar that are out in greater Minnesota and may have to travel a distance to take your child to the doctor or to go see a specialist. Sometimes you might have to stay overnight. If you're on TEFRA medical assistance or regular MA, if you talk with your financial worker and get some forms before you go to the appointment or before your child has a hospital stay, you may be able to get your mileage paid for. You may be able to get your parking reimbursed, your hotel room, and potentially some meals paid for. So it's important to talk with the county financial worker at the Human Services Agency in your county. This next PowerPoint talks about 3 doors into MA. Again, this is all kind of background for you to see where TEFRA fits into the big picture. This is the first door into MA is the MA basis of eligibility. And actually that is on the PowerPoint called Minnesota Healthcare Programs Income and Asset Grid Guideline. It is a table with various columns and numbers on it. And if you look at the first page, you will see that I have included this guideline in for you that runs from March 1st of this year, 11th, and it's going to expire June 30th of 2011. And in your handout, you also have a second one that looks very similar to this handout, but if you check the date, you'll see that that guideline starts July 1st of 2011 and goes through June 30th, 2012. I wanted to include that for you, otherwise you wouldn't have next year or starting in July, you wouldn't have the income guidelines. But this is what we mean when we talk about MA basis of eligibility, which is the first door into MA. We always want to start looking at this as a possible funding source for your child, because with a basis of eligibility, there's no spend down with this, there's no parental fee or premium to pay. And who you are or what your basis of eligibility is has its own income guideline amount. And there are different income guidelines for who you are in the family. You'll see if you're a pregnant woman, they have very high income guidelines so that they can get the prenatal care that they need. Then there are different income guidelines for infants under age 2. Then there's a category children 2 through 18, children 19 to 20, MA adults with children, and then elderly, blind, disabled. And then the last category there is new this year. That's the category ages 21 to 65 without children. That is the new category that Governor Dayton just did bring to Minnesota. The income guidelines are very strict, or I say that you have to have a limited income. This is to replace the old benefit that was called GAMC. Now on the second slide, you'll see number 2. The second door into MA is MA eligibility with a spend down. This means that there's a cost-sharing approach similar to having an insurance deductible that allows MA eligibility whose income is over income guidelines. In other words, those guidelines that we talked about on the last PowerPoint, if you're over those income guidelines, there is a way that you can spend down your income by incurring or paying some medical bills to meet the spend down, and then MA would be an option for you. You would be MA eligible. There is a whole handout of 3 pages that talks about spend down handout. And if you are applying for medical assistance for your child and have questions about it, you can bring that handout along and talk to someone at your county human services agency, usually the financial worker, and ask here when you apply if you might be eligible for a spend down. The third door into medical assistance is being certified disabled. You'll see the first bullet is what we're going to be talking about tonight, MA TEFRA, which is for disabled children less than 19 years of age. It doesn't count parental income when determining eligibility. It counts the child's income, but the parents may have to pay a monthly parental fee. And you'll see listed below there is an MA TEFRA handout for that. And we're going to talk a lot more about parental fees as we go along. The second way to become certified disabled and be eligible for medical assistance is called MAEPD. That is for persons 16 to 65 who are certified disabled but are employed. These individuals pay a monthly premium in order to have medical assistance. So they are paying a monthly premium. The third bullet is SSI, or Supplemental Security Income, which is a federal program through the Social Security Administration. The people who are eligible for SSI are automatically eligible for medical assistance. There is no parental fee for MA, and there's no premium to pay. There is a handout also in with your handouts about SSI and the disability guidelines, which we'll talk about a little bit later. What you do to determine to be able to get medical assistance is you need to take proof that you are receiving SSI payments in a monthly check for your child. You need to take that proof down to your county human services agency and show that to the financial worker, and she will begin the process to put your child on medical assistance. So what does TEFRA mean? And I just wanted to mention there is a multi-page handout. This is all taken from our May's manual, and everything that we're talking about is in that handout. TEFRA, the name comes from the 1982 federal law called Tax Equity and Fiscal Responsibility Act. And you can see that act had nothing to do per se with health care, except something that they tacked on at the end. But if you take the first letters out of Tax Equity Fiscal Responsibility Act, put it together, it becomes TEFRA. This option allows states to make MA available to certain children with disabilities or complex medical needs without counting parents' income. However, the parents may have to pay a monthly parental fee. And just so you know, TEFRA MA covers the exact same services as regular MA. Those are the services that we looked at. I think it was on your PowerPoint number 3, where we talked about the different services. It does not include any extra services like respite care. That is not included in TEFRA. It's just the same services as regular MA. Rule always to remember, always first apply for MA basis of eligibility before looking at eligibility for TEFRA. It's a financial advantage for the family because, like I said before, they don't have to pay a monthly parental fee or any premium. So who's eligible for TEFRA? Well, the person applying must meet all of the following. The child or youth must be under age 19. They must live with at least one biological or adoptive parent. The child or youth needs to be certified disabled and needs a level of care comparable to that being given in a medical facility. Now, the medical facility could be a hospital, a nursing home, or an intermediate care facility, such as one that may house developmentally disabled youth, or it could be residential treatment center for a child or youth with mental health concerns. It's important to note that the cost of home care must cost medical assistance less than care in a medical institution. So the budget to keep someone at home must cost MA less than what it would cost to keep that child in the hospital or nursing home. The child's eligibility is determined using the child's income. So the child's income must be under 100% of federal poverty guideline, and that's on the income and asset guideline page for a family size of 1. So in looking at financial eligibility for TEFRA, the child is considered his or her own family with a family size of 1. And then you look under the category or the column that is for disabled people. And you will find that the income cutoff for a child, a family of 1, to be eligible for TEFRA, his or her income must be less than $903 a month, or if you're looking at a year's income, $10,836 a year for the child's income. And it's important to note it does not consider child support as counted towards the child's income. Now, there is required documentation to complete to determine disability. There are 3 required documentation handouts that I included in the handouts. One is for physical disability, one is for developmental disability, and one is for mental health disability. You will see on there they do have requirements that the physical from the physician needs to be less than 3 months old. So they want to make sure that everything is very current. We can't have old medical records used. You can see there they want also to have lab work, height and weight. They also want reports from any medical specialist the child has seen, copies of the child's IEP, and if the child's also getting any special services at school or any reports from a child's hospitalization. You will also see that there is a special form that the parents need to complete, the Children's Disability Worksheet. And I'm going to talk to you about that in more detail in a little bit. There's also a developmental disability handout that talks about documentation if your child has a developmental disability. That also does require an updated history and physical by a medical doctor within the last 3 months. It also asks about medication, reports from any medical specialists or mental health specialists the child is seeing. Again, that child's disability worksheet for the family to complete, the IEP. But what's also important for a child with developmental disability is that the child's IQ scores are included, as well as adaptive behavior rating done by the parent and the teacher. That's what is unique about the developmental disability, as well then as any other services that the child is receiving. And then the last one for the mental health disability, so too also has the medical evaluation from the doctor, but with this one you need to also include the psychiatric or psychological evaluation, frequently called the diagnostic assessment, and it is to be no more than 1 year old, and it needs to be a complete diagnostic assessment. There is also included the most current treatment plan by the mental health professional, and also any summaries from hospital or day treatment reports if the child is attending a day treatment program, and then also the information from the school, from an IEP, and documentation from the teachers on the child's grades and behaviors in school. And then also, as for all the other kinds of disabilities, you would need to include the Children's Disability Worksheet. Now, There is help available for families trying to put all these information together. It's important to gather all of the information and send it at one time to the state medical review team. These forms I was just talking about for the required documentation, the financial worker or your disability social worker at the county would give those to you. If you have any questions, you can call the state medical review team. That's what the SMRT stands for, at their St. Paul number, and you'll also see a toll-free number. And they are very willing to talk to you about the necessary documentation that you need to send in. Also, they can assist you in trying to identify names of physicians or specialists that your child might have seen, especially if the clinic has changed the name or maybe the clinic has moved to another place. They can try to help you. If there's a concern about getting an updated doctor appointment or an updated specialist visit and maybe some extra more current lab tests or x-rays, but your insurance won't cover it or you don't have any insurance, the state medical review team can work with you and the financial worker at the county to put together some funding so that you can get the necessary appointments and tests required for them to determine if your child is disabled. Okay, so how is eligibility determined for TEFRA? First, the State Medical Review Team, SMRT, approves TEFRA eligibility or TEFRA certification for 1 to 4 years. It varies individually depending on the child's diagnoses and how long they think it might be if there's going to be any changes. Sometimes there are children who are very quickly ill and very severely ill, such as a child with leukemia, and so they might want to have a shorter period of time for certification to be able to tell when that child hopefully will be successful in combating the leukemia and when the child will be considered cancer-free and maybe has had some years of follow-up. But eventually that child may no longer be eligible for TEFRA because they are no longer meeting the disability requirements for TEFRA. However, a child that may have cerebral palsy or Down syndrome, those conditions may fluctuate a bit over the years, but that disability may not ever improve to the point where the child would not be considered disabled. So the first step is the disability review. That's what we were talking about, is gathering all those medical, psychological, school records to determine if the condition that your child has, or conditions, we know that some children have multiple complex conditions. Some children have medical conditions along with developmental disabilities and mental health concerns. So we need to gather all that information to determine if the conditions are severe enough to meet the disability criteria from the Social Security Administration. Now you see SSI medical guidelines written there, Part B. That's the part of what they call the Blue Book that lists all the different disability guidelines for the child. Now there is a Part A to this Blue Book. It's still called SSI Medical Evaluation Guidelines, but Part A is for children through adults, children who have turned 18 and are now considered adults. And if you would like to look at the adult disability guideline, the website is there, written there for you, and that website will have both the Part A for adults and Part B for children. But I did include for you a many-page document with the title Index for the SSI Disability Guidelines. And I am thinking, because you are listening, your child, or maybe it's your grandchild or your nephew, may have a disability, and you are wondering if the disability does meet the disability guidelines. You can look it up in here and see if your child has some of these conditions. Now, sometimes it talks about lab values or pulmonary function tests, and you probably won't understand that. I don't always understand that either. So you can take this to your physician with you and show him, because not always do they know, not always does your physician know what the disability guideline is for your child's condition. So this would be a help for him too. He might want to download a copy of this for his own resource. Now, on the second slide of how is eligibility determined, this is where we talk about that handout. It's called the State Medical Review Team's Children's Disability Worksheet. And you see it's numbered there, DHS 6126. That means it's a Department of Human Services form, and its ID number is 6126. So you can go to the Department of Human Services website, and you can download this form for yourself or for your neighbor. You can access the different forms from the Department of Human Services by going through to their website, such as this handout or the application to apply for medical assistance. All this is out there for you if you have a computer and a printer, or can go to the library and get it printed. Now, the Children's Disability Worksheet is really important because it's an extra step. Not only does the child need to have a severe condition that's considered a disability, but the child, step 2, has to need a certain level of care. Remember, we talked about the child needs to have care that is similar to care in the hospital, nursing home, intermediate care facility, regional treatment center. So in a way to figure this out, if that is being met, the State Medical Review Team looks at the different medical reports, looks at the reports from the school, looks from the mental health records, but they also look at the Children's Disability Worksheet, which the parent completes, and it's about the parent's view of their child and the child's overall condition, what kind of diagnoses does he have. It talks about filling in information about your child's ability to perform activities of daily living. That's an activity such as being able to go to the bathroom and toilet independently. That talks about bathing independently, or how much help does your child need, or is your child able to walk and be mobile by themselves. Those are activities of daily living. Same as feeding themselves. Can the child feed themselves? Then there's also wanting to know about the child's level of functioning and interactions, being that how does your child function at school? How does your child interact on the playground or in different sports? What's your child's behavior like at home, school, or in the community? And we know that children's behavior, some children's behavior can vary and change in different environments. And also, what is the variety and the intensity of the medical care or other services that the child is receiving? So this is an opportunity to tell it like it is about your child's typical day or days. Sometimes it might be hard to be open and honest about some of your child's behavior or some of the things that he's not able to do, but it really is to your advantage to honestly and openly record the needs of your child and how much help he or she does need, be it help at home, at school, by the doctors, by a variety of other professionals. So, how do you apply for TEFRA? Well, I also did give you a handout of the actual application from the Department of Human Services. You can see here on the slide that this one is called Minnesota Healthcare Program Application, DHS, and the number is 3417. Again, you can download that yourself from the Department of Human Services website. Now, we want you to start out completing this application because this is the way you also can find out if your child might be eligible for MA with a basis of eligibility. So you are going to look at that income and asset guideline form and look in the column that talks about the appropriate age of your child. So if your child 0 to 2 or your child is 2 to 18, that would be helping you to find the financial eligibility there. Again, there's no parental fee here. So there, the next bullet, the second bullet, is the Department of Human Services website. If you go to their website, you can look in the left side of the screen. There's a left column and click on application forms and a whole list of applications will come up. What you do is scroll down to Minnesota Healthcare Programs application and you click and print. Now you can't fill the application out online at this time. You have to print a paper copy and then you have to mail it or bring it in to your county human service agency. You can also pick up the actual paper copy of the application at your county human service agency, or you can call them and have them mail it to you. Applications are available in different languages. So, and there also is, I think the next slide talks about needing help to complete the application. There are agencies out in communities who do help families fill out the application because even though it's supposed to, some people say it's supposed to be simplified and easier, it still is rather complicated to complete. So I have listed their PACER as a possibility. Wendy Ringer, and her name and email will be at the end of the PowerPoint presentation, is available at PACER to help you with the application. But we noticed that we have made an error in the phone numbers here, and on your PowerPoint, if you've downloaded it, this is the correct phone number, so you might want to correct that number right now. Otherwise, when the presentation is over, it will be corrected in the archive and you can reprint it at that time. However, the correct phone number for Wendy, for those of you in the metro, is 952-838-9000, 952-838-9000, or the toll-free number is 1-800-537-2237, 1-800-537-2237. Now, just two helpful hints. When you are completing this application, make sure when you are on page 3, now I know you can't all get to the handout right away and look for it, so I have written the questions down for you. On page 3, it's question number 9. It's called Additional Household Information. That's the heading on the question. Question number 3 is anyone blind or does anyone have a physical or mental health condition that limits the ability to work or perform daily activities? That question is getting at if your person, whether it's an adult or a child or a youth, has a disability, and it refers to the ability to work or perform daily activities. You want to check yes on that question, and you also would like to, on your application, name who that is, and I believe you could also write on there what they have trouble with. The 7th question is, do you want help paying for medical bills from the past 3 months? If you have old medical bills, unpaid or paid, please check that yes, because they can go back and pay for those old medical bills if you're determined eligible. And again, then you can write in there what months do you want them to pay for. So if you're applying in August, but your child had an emergency room visit because of a seizure in July, then you write down in there July and the year, which would be 2011. Okay, if your child is not eligible with that MA basis of eligibility on the income grid, then you would ask to speak to a disability social worker. Some families have also, because they know they have applied before and were not eligible, have written the words TEFRA in several places on their application, so that if the people who are looking and determining eligibility find that your child is not eligible, that they would then look at it for a disability. This is supposed to happen automatically when you answer that question number 3, is anyone blind or does anyone have a physical or mental health condition? But sometimes there are new employees determining eligibility and they forget or they don't remember because they haven't learned how to do that. So this is a time when parents need to be advocates for their child. And if you think your child should be looked at for TEFRA eligibility, you need to call right away back to the Human Service Agency, talk to the financial worker, or go in person and say you want to talk to a disability social worker. And you don't have to go into a great bit of detail. Just say very firmly, my child has special needs, special health needs, and needs help. And if that doesn't work, ask to speak to the supervisor. Now, and the last bullet here talks about remember to provide all the required documentation to the county for the SMRT disability determination. The information is brought in to the County Human Services Office, all put together and mailed. Now, if your child has already been determined disabled by Social Security Administration, that's great. You bring that proof in. But if you're not receiving monthly disability checks because you're over income, you would need to also then fill out the child's disability worksheet for that. Now, what happens if the child doesn't, if the family is told that the child does not meet the disability guideline? Well, a family may appeal that decision. The appeal request for a fair hearing must be either in writing or be done verbally within 30 days. The timelines are extremely important. So you must do that within 30 days by either telling your county worker or writing a letter to the state appeal office at the Department of Human Services. Now, when you would get your denial in the mail, it would come in the mail. When you get that, there is information on that letter on where you can send your written appeal or who you can call. There will be phone numbers and addresses for you there to use. Now, if your child has been on TEFRA and you're just doing that ongoing recertification, but all of a sudden now your child is denied eligibility, maybe in the case that we talked about earlier in the child who has leukemia, maybe this SMRT team thinks the child doesn't meet disability requirements and level of care requirement anymore. If you want to appeal that, you can appeal that also, and your child can stay on TEFRA during the appeal process. But again, timelines are very important. You need to appeal within 10 days of receiving the notice from the Department of Human Services of the denial or the termination date. So again, 10 days is very important. Frequently, parents say, what happens when my child turns 18 years of age? Well, when your child has his 18th birthday, it's good to start the process for applying for SSI, the Supplemental Security Income. Remember, that's that monthly check for your child. This time your child will more likely be eligible for it because now you will be applying for SSI using your child's income, not the parent's income. And as you would understand, the youth's income at 18 would be significantly less than a parent or both parents together. So you figure out that application for SSI while you've sent your paperwork in for SSI, and sometimes, I should say, frequently your first try at trying to establish eligibility for SSI may get denied, and that may be because you are missing some medical documentation. So we have heard that there is encouragement for families to reapply or to appeal. But when you're applying for SSI, your child's TEFRA is left open and will continue to pay medical bills for your child. When you are applying for SSI for your child, even though he's only 18, at this time eligibility will be determined using adult disability criteria. No longer will SSI look at your child using children's criteria, and the children's criteria is centered around the child being able to do and function like a typical child, go to birthday parties, attend school, go to the park, sleep by themselves, feed themselves. But for an adult, once they're 18, it looks at more the ability to be gainfully employed and hold a job. So adult criteria is different. If SSI determines that your youth who's 18 years old, going to be 19, and continues to live with you, but they consider him not disabled, your child could still be eligible for medical assistance when the child's living with you, but they would continue to use your income, and you would look at the column that says children 19 through 20. That's because the Department of Human Services considers a child as born all the way up to age 18, excuse me, all the way through the teenage years, the child would be considered a child up to age 21. When the child becomes age 21, they are considered an adult. Now, if the child is married, that child would then be considered emancipated. I did forget to mention that, or maybe I did mention that you would look at the column on the income and asset grid. You would then use the column children 19 to 20 years of age. And actually that income amount is the same income amount as an adult with children in the home, or the same guideline that would be used for you as the parent. Okay, now we're on to parental fee. Some families have to pay a parental fee to reimburse the state for part of their child's medical assistance costs, or the costs that medical assistance has paid. Parental fees are based on family and income size, and they can change every year due to changes in the federal poverty guidelines, changes in the family income, or changes in the family size. Parents not living together or divorced may each have to pay a parental fee based on their own individual income, and families that may have more than one certified disabled child only have to pay one parental fee. What information is used to determine a parental fee? I've bulleted out there the information. It's the adjusted gross income before taxes from last year's federal tax return. However, important to note, parental fee does not include step-parent income. The second bullet, amount of monthly court-ordered child support the parent pays for the child. Number 3, the household size. It includes the child on MA, natural and adoptive parents and dependents. Step-parents and step-children are not counted in the household size. Fourth bullet, whether the child receiving MA lives in the parent's home, and whether the parents carry private insurance for the child receiving MA. Now, there's just recently, this past year, been added a new thing on the Department of Human Services website. This new tool that's available is the Parental Fee Estimator. And I've listed the web address there. It'll take you right there. Now you can figure this out, because we've had parents say, well, I don't want to go through all the hassle of filling out all the application and then gathering all that documentation and filling out all the forms if we're not going to be eligible unless we pay $1,000 parental fee. Well, this you can do in the privacy of your home. It takes about 5 seconds. Now, and the next slide will have some examples of that. But just remember, even though you get your estimated number from the estimator, you still have to complete, and I gave it to you as a handout, the MA parental fee form. That's also on the DHS website. You must complete that, and you must send it in with last year's copy of your federal income tax return. It's really nice now that there is a unit now called the Parental Fee Unit. The phone numbers I've listed for you there, and it's great because if you have any questions, you can call someone up at the Department of Human Services and ask them questions on what information you may have to submit, or did you fill out the form right. So that's a really good thing. Now, this is examples of the monthly parental fees. I just plugged in two different amounts and kind of changed both scenarios. So you can see on the first one with one parent living in the home, the estimated parental fee with an income of $45,000 came to $47.94 a month. In comparison to the second family who had the $135,000 income, two parents in the home and three children, their parental fee is $860.02. So you see there's quite a difference there. And some people wonder, well, I don't know if this is worth it or not if I pay the parental fee. Well, this is kind of a little helpful way that you can look at figuring out if it's worth it for you to do TEFRA. On the left side, you'll see doctor visit copay 25 copay for meds, 25 copay for OT, diapers, and $1,000 a month for PCA. So this costs the family out of pocket $1,100 a month. The second column, you see the family has TEFRA, and with TEFRA, there are no copays because TEFRA MA pays them. So it's zero for the doctor visit, zero for the medications, zero for the therapy, zero for the diapers for the child over age 4 with a disability, and zero for the PCAs. But the parental fee is $500 a month. Is it worth it? Well, with this family that's got the PCA, their costs come to $1,100 a month without TEFRA. So you'd look at it and say, yes, the $500 parental fee is worth it because it saves me $600. But if you move your finger down, you see we've taken out PCA services, and then lo and behold, the family's only paying $100 a month out of their pocket. So the answer for is it worth it to pay a $500 parental fee when the family's only spending $100 a month, you might say no, it would not be worth it for the family. It sometimes helps to put these things out in written form like that. Now, one thing I've been asked to mention by the schools is something called a disparity agreement, and that's in your handout that's from the Department of Ed about third-party billing. A disparity agreement with Department of Human Services means that the child is on TEFRA, but TEFRA is only used while the child is at school. The school uses TEFRA to bill for the services the school is providing. The family does not use TEFRA for their child to get any doctor visits paid, to get medications, no PCA services in the community, no therapy sessions. It's only used at school. Now, if the family is interested and wants to do a disparity agreement, the phone number is there that you would call Department of Human Services and talk to them about this. They are the ones that would work with the family to make a disparity agreement. What if the parents pay more in parental fees than MA pays for the child's care? That's always a big question. The total amount the parent pays for the year will never be higher than the cost of the services MA paid. At the end of the 12-month period, parents are sent a 12-month or a yearly statement comparing the cost of services MA paid against what the parents have paid in their parental fees. And if the parents paid more than MA paid, their overpayment of the parental fees is credited towards next year's parental fee. This is just a list of different changes that might occur with the family, such as maybe the family size grew by 2, maybe the parents separate, maybe the parent changes, or maybe the parent gets private insurance for their child. This needs to be reported as soon as possible and within 30 days for sure to the parental fee unit That was the number we had talked about earlier. Preferably report this in writing because these changes may change your parental fee. It may go up, it may go down. Can parents appeal a parental fee? Well, parents have the right to ask for a review of their parental fee, or they can appeal. There are specific timelines that are described in the handout, but it's important to know that the legislature has made Minnesota law such that it does not give the Department of Human Services or the appeals referee any authority to waive a parental fee. In other words, it cannot take away a parental fee when in fact the parent does owe a parental fee. So that is important to know. Now, questions after the webinar. Here is Wendy Ringer again at Pacer's phone number and email address. We need to change the phone number for the 1-800 number is 1-800-537-2237. The 800 number is 800-537-2237. Wendy will be happy to answer any questions about the PowerPoint or help with any application or other advocacy. Sarah Thorson at the Minnesota Department of Health in the program Minnesota Children and Youth with Special Health Needs can also be a resource. We have one question. What does certified disabled mean? Certified disabled means that the child is meeting disability requirements or disability criteria through the Social Security Administration. It's saying that your child is not able to do the things that are typically done by a child who is growing and developing normally, and the child needs extra medical care or care from a variety of specialists. We have a question. Are you automatically eligible for PCA services if you are on medical assistance? And the answer to that is no. While MA does pay for PCA services, you're not automatically eligible. The family must call a public health nurse to come to the home and do a public health nurse assessment to determine if your child meets the criteria for eligibility for PCA services. So unfortunately, now that the timer went off, I realize that the webinar time has now ended. I hope you have enjoyed the webinar. I'm sorry we didn't get to answer all of your questions, but again, Wendy Ringer at Pacer is sitting right here with me, and she will be available for you to submit questions to by email or by phone. Again, if you want more assistance, please call Wendy. So thank you very much for participating. I've enjoyed this evening being with you.